Good afternoon and welcome. I'm Jenny Roe. I direct the Centre for Design and Health here in the Architecture School. Thrilled to have you all here with us today. Specifically thrilled to have our two guests. I'm going to introduce them in a moment, Professor Aaron Hipp and Professor Deepti Aldaka. Thank you so much for coming from North Carolina State University. So why are we here today? Well, there's two main reasons, two primary reasons. To relay to you all what restorative environments are, why they are important to urban mental health particularly, and why at this moment in time they are super important. And secondly, is to celebrate the publication of Restorative Cities. It was published a year ago. Layla, McCay, my co-author, and I took the book on a kind of global world book tour, mostly remotely, and the book has come home today into the School of Architecture, where it was conceived, conceptualized, and evolved. Before I start, some thank yous to the Dean's Office, who helped facilitate and set up this event today, and who also funded the book illustrations. The illustrations in the book are a real joy, and I want to make a call out to Spring Brasher Beck, our illustrator. She was a graduate from this school in architecture in 2019, and she can't be with us today. I also want to thank our book editor, Stephen Smith. Stephen, raise your hand, please, because he is fortunately with us today. He came out of retirement to edit this book and had quite a job on his hands because he had two very different narrators and authors who stylistically varied. So thank you, Stephen, and thank you to all of you. Next, I'm going to introduce our guests. Professor Hipp is Associate Professor of Community Health and Sustainability and Associate Director for Social and Behavioral Science Applications in the Center for Geospatial Analytics at NC State. Quite a lot to unpick there, Aaron. His research focuses on equitable access and spaces for active living, including walkability, with specific attention on innovation in measurement development. Next, I'm going to turn to Professor Aldaka. Can you just raise your hand? Who directs the Natural Learning Initiative at NC State University and is Associate Professor in the Department of Landscape Architecture and Environmental Planning. She brings a background in architecture, urban design, and public health, and her research focuses on generating, translating, and scaling up evidence for reducing health inequalities in underserved populations, including low to middle income countries, and their role for nature and child development and well-being. I'm going to briefly introduce the context for this roundtable before passing it over to our guest speakers. So I perceive our cities as bastions of opportunity. In public health, we talk about the urban advantage, more jobs, access to culture and recreational opportunities, more people to mingle with and meet. But our cities also impose environmental stresses that exacerbate mental health: noise, pollution, overcrowding, crime. And the rates of serious mental health problems, schizophrenia, psychosis, are much higher in cities than in rural communities. But these patterns are far from straightforward. There's some recent research to suggest large cities are better for our mental health because they promote more opportunities for social interaction. This conflict has led myself, our two guest scholars, to ask how good are cities and bad for our mental health, and what role can urban design play? But just so we're all on the same page at the start of this symposium, what is mental health? So according to the World Health Organization, mental health is a state where a person realizes their own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to their community. But right now, I don't have good news about global mental health. We're living in an age of anxiety. Stress and depressive orders are rising, particularly in the 16 to 24 age group. This is debilitating, not just at an individual level, but at a societal level also. Mental health problems cost the global economy billions of dollars each year, lost in economic production, but also societal capacity. Some critics believe a drug-based approach to mental illness is failing us. Psychiatric medicine is simply not advancing with anything like the speed of, let's say, medication for cancer. We're not making progress. In fact, mental health outcomes are declining. So we need a wider public health approach and to strengthen our response, and that includes looking at our built environment for solutions. So what is a restorative environment, first of all? Well, it's any environment that rejuvenates and restores our cognitive, our mental, attentional resources. It improves our emotional well-being and our psychophysiological stress. I've postulated that this triggers a much broader, what I call broaden and build response that builds our capacity for resiliency and to manage adverse experiences. And this is set out in a forthcoming book I've co-edited called The Infrastructure of Happiness, which is being released in October of this year. So next, what does a restorative environment look like and what are its attributes? So restorative environments can be found in just about any city. Historical downtowns, churches, art galleries, aquariums, our city parks, waterfronts, and natural environments. And it's posited that they have four critical attributes. These are both psychological processes and content of that environment. They generate a sense of fascination. That means a sense of wonder, of curiosity and awe. They generate a sense of being away, a sense of escape from our everyday. They have a good compatibility with your needs at that moment in time. And they offer a sense of extent, which is variously interpreted in the literature as looking up and out of our world, beyond the horizon, for example, but also an environment that is legible, coherent, and easy to navigate. So just pause for a minute and think of your own favorite restorative environment where you go to recover from stress. I would posit a guess that it would have at least two of these attributes. So my co-author Layla, McCay, and I brought together literally thousands of studies from multiple disciplines and broke restorative environments down into seven pillars of restorative components in our cities. I don't have time to describe each of these in any depth, but our speakers today are going to speak to some of these pieces, and they are mostly self-explanatory in this framework diagram. Here's just one example of the green city. That simply means a city that's designed with nature right in the heart of it. It aligns with just about every other pillar in the framework, including the blue city, which includes access to our water systems and cities. And here's just one example of the illustrations in the book that is pulling together literally thousands of studies, evidencing in one simple diagram the benefits of access to parks, pocket green space, green corridors in our cities. It's designed like this for impact and to reach those that govern our cities, people in public health, in planning, busy people like yourselves who don't have time to read systematic reviews. Now, my own research over the last 18 years has evidenced each of these benefits. And going forwards, we're going to be using this model in research in collaboration with Norfolk State University, where we're going to be evidencing these benefits as part of a major NSF grant exploring green infrastructure as a climate adaptation tool to mop up water in Norfolk City, VA. Now, I'm not going to be talking about my research today. You can come talk to me at any point about my research. I'm going to hand over now to our panelists. And we're going to start with Dr. Aaron Hipp. Aaron, would you like to come up to the podium? And you're going to be talking about the active and neighbourly city. Thank you.
Yeah. Hi, everyone. Good afternoon. My name is Aaron Hipp. I am from North Carolina State, and I'm excited. Thank you, Dr. Roe, for inviting us today, and it's a pleasure to be here with you. I am going to focus on active and neighborly cities from within Dr. Roe's book. I did want to set the stage really quick. This is there are three of us in an hour. So I just want to tell you a little about my background, but also just to drive home how interdisciplinary the work is around restorative cities and restorative environments. And so briefly, I have a bachelor's in biology, a PhD in social ecology, which included coursework in urban and regional planning, environmental health sciences, criminology, law and society, and psychology and social behavior. And so in the end, my dissertation was primarily environmental psychology, which is how I met Dr. Roe in 2008. From there, my first faculty position was as an environmental health professor in a school or in a program of public health, but in a school of social work. I then became part of a research center related to cancer behaviors and outcomes. And then I moved back to North Carolina, where I'm from, and to a college of natural resources, a department of parks, recreation, and tourism management. And as Dr. Rowe mentioned, I sit in the Center for Geospatial Analytics. That's where my office is, and that's where I also have students and responsibilities. And I'm also part, finally, of our Center for Human Health and the Environment. And so all of these experiences have kind of brought me to where I am with my research and teaching today. But it also, I think, takes home that when you think about our environments and the behaviors we do in those environments, that there's a lot of disciplines that touch this. And so I am going to focus on active and neighborly today with two brief examples. And I love the illustrations. So I didn't know the background story of the illustrations, but I do love the illustrations in the book. And when thinking about active cities or active living, which is primarily how I define my research right now, is around active living. Active living can mean exercising and going to the gym or going for a run or playing football. But it's also just our everyday movements. It can be the design of classrooms that facilitate standing up. It can be the design of buildings that facilitate the ease of taking stairs. But it's also our commuting patterns, how we get from our dorm or our home to work or to school, and how we get from point A to point B. And so I want to focus a little with active cities on this kind of point A to point B piece. And it's nicely highlighted here with a complete street where you've got cyclists and walkers. You have a bike share, you've got vehicles, you've got public transit. And so this is, yes, very well done and nicely designed environment here. But I want to bring up some work that we've done around open streets. And so if you're not familiar, open streets are events or programs that generally started in Columbia about 30 or 40 years ago, the country of Columbia. And open streets are where public streets, are opened for activity. They're open for socializing. They're open for dining. These streets are closed off to vehicular traffic. And so it's called open streets. It's democratizing these spaces. And so this is an open streets in St. Louis. You've got the bubbles, the unicycle, and people out enjoying this public space and enjoying it for activity and engaging with other people. This is another example here, also in St. Louis, in a very different neighborhood in the city. This one was around Halloween weekend, and so you've got a kid there dressed up. And so again, opening up public spaces, especially in communities that don't have access to green spaces, that don't have access to parks, opening these up for a Saturday afternoon, a Sunday afternoon, for folks to meet their neighbors, to bring people in, to new neighborhoods and see new commercial spaces. But it's also meant to highlight how easy it is to walk or cycle places or take public transit. Oftentimes there are buses there where people can practice getting on and off. It's also used to highlight where there's needs for improvements in the infrastructure for biking, walking, and public transit. And so with these open streets, they have been highlighted, and perhaps if you are familiar, it's during the pandemic. New York City opened many streets across New York City during the pandemic for places for people to be outside, to socially distance, and to dine. Durham and Raleigh in North Carolina by us certainly did this. And some of this has maintained both in Durham and in New York City, where these streets are now permanently opened or always open, say, on a Saturday afternoon. And this includes, opening up parking spaces that were previously for vehicles, and now these are opened up for dining or some other type of activity. And so with our work on open streets, at the time, there were about 100, this was pre-pandemic work, there were over 100 different open streets programs in the U.S., And this is focused primarily on the ones in St. Louis while I was there. And we surveyed users. And, we asked questions about, is Open Streets a free event that welcomes everyone? And 99% of our respondents agreed or strongly agreed with that comment. Open Streets strengthen our community. Again, 100% agreeing or strongly agreeing. 97% said that Open Streets made people feel safe. And then, does Open Streets change your feelings about the city? And 94% said yes, positively there. And so these programs, these events are bringing in neighbors. It's bringing in new neighbors. So you could cycle, you could take public transit, you could drive from your neighborhood to another neighborhood where a street is open. You're seeing new restaurants, new places to spend money. They'd like to say, when you're driving, you're sitting on your wallet, but when you're walking, you're not. And so it invites further commerce there. But to bring this a little back to mental health and restorative environments, some research by colleagues, Glasgow, and again, this was just right before the pandemic, and focusing on kind of my interest in using technology in research. Glasgow and colleagues used this as, it's called an ecological momentary assessment. And so somebody commuting, when their phone started, your accelerometer in your phone, when it started moving, they would be pinged with a brief questionnaire, and they could state what their mode of transportation was right then, and then they could answer on a single screen this quick survey. So, for these pairs of words, are you more stressed or relaxed during this commute? Are you more sad or happy? Are you bored or interested, irritated or pleased? Do you feel unsociable or sociable during this commuting experience? And across the board, that walking was across the board more positive, and then cycling, and then public transit, and then the personal car across the board here. So just a brief example of the active city and active living, and how that I perceive as being related to restorative environments and restoration. So the second example I want to highlight is around neighborly cities and the restorative city framework. And here I want to introduce you, if you're not familiar with purpose-built communities. Again, this is a program that's across the U.S. We have one in Southeast Raleigh. This is a project that I'm actively working on. I first learned about this started in Atlanta. I first learned about one in Orlando. These purpose-built communities are maybe 10 or 12 years old. And so the idea is you've got a defined neighborhood. Our defined neighborhood is one zip code. There's about 25,000 residents there. And you've got a quarterback organization, usually a nonprofit organization. And within the neighborhood, this quarterback organization is working on mixed income housing, cradle to college education, and then community wellness. And so the one we're working on in Southeast Raleigh, this is the footprint here. This is referred to as the hearth or the beacon site. And so this is where our research has been working. This is Southeast Raleigh Elementary School is up at the top. It is an elementary school, preschool through 5th grade, and a YMCA built under the same roof. There you can see there's swimming pools, there's park space, playgrounds, connectivity to the city Greenway system. There's a meditation garden. There's low-income housing here. And then this is going to be commercial space, but it has not been built out yet. This is a busy road that will have bus rapid transit. So an alternative to, say, light rail, where buses will have access to their own route and raised platforms for expedited entrance and egress from the bus. So looking specifically, I work on this project with a colleague in our School of Architecture. And so we were mostly interested on the building and the inside of the building. So at the top here is where the school is. So kind of pre-K and kindergarten on this wing, and then 1st grade through 5th up top. Down here is the YMCA space. And then this space in the middle is shared space. So during the school year and school day, that's the cafeteria. And then weekends and summertime, it's extra play space or camp space for the YMCA to use. It's also open to the community, as is their library. The library has access for the community to use as a public library outside of school time, as well as an outside reading space, as you'll see. So this is, an example of the outdoor reading space, the playground that is specific to pre-K and kindergarten, including community garden space here. So the school opened in September of 2019. Our research project started March 13th of 2020, which was really bad timing for what we had planned to do, but has been interesting in terms of the ways we've been able to and not able to engage with the community, and some of what we have been able to learn here. One really nice piece of this is that this was one of the first places that was able to allow students back in, because there was enough space to keep students 6 feet apart. And so we were able to visit, and you would have kids from maybe 20 different elementary schools with their county provided laptops and YMCA counselors going around helping them with their lessons. And so again, just focusing here on the entire footprint or the beacon site, we weren't able to engage with families and kids because the school was closed for about a year and a half, but we were able to reach out to the educators and the staff at the school. And we had a match school that had been open for about 10 years, designed by the same architects, serving the same zip code. And so we asked about 30 to 40 teachers at each of these schools a set of questions about the environment that their school is in and around. And here are just a few results to highlight. So Southeast Raleigh is that intervention school, and then the match school here. The percentiles are the percent agreeing or strong or somewhat agreeing. So those in Southeast Raleigh, and these are all significant results. In Southeast Raleigh, the faculty and staff believe that the school actively promotes a sense of belonging, right? Because that's the purpose of this beacon site. It's not just an education, but it's got this greater plan and greater integration with the community. So the teachers believe that there's this sense of belonging. The teachers and staff believe that the community in the school engages with the broader Raleigh community, that they feel connected to the Southeast Raleigh community, the specific neighborhood, and that the community members feel back connected to the city, or to the school, whether they have children in that kind of 4-year-old to 11-year-old age group. Also, that the students feel valued in this school, having this space that was designed for them and their families. So the students feel valued, the families feel valued, and the faculty and staff feel valued. So it's been a very successful project and intervention, and with complete community engagement in the process of designing the space. And then finally, I just want to point out, again, kind of getting back to that interdisciplinary, and that it does take a village to build a restorative environment, to build a restorative city. And so you've got tweets from the YMCA, from the school, and then Southeast Raleigh promises that umbrella nonprofit. And so, there's neighborhood food delivery. There's a Black farmers market that only supports Black and brown farmers. There's health screening resources, all sorts of, especially related to COVID, but back to school physicals and such. The Juneteenth celebration in the community. And then the 3rd through 5th graders at the school are required to learn how to swim as part of their physical education. And so all of this is bringing in that support for contributing to this neighborly environment and providing benefits across the board to the communities that live there. So with that, I will pass it on for our next two with Playable and Inclusive Cities and Dr. Laka.
Thank you.
Just the down button.
Okay. All right. Thank you, everyone. It's a pleasure to be here. I'm going to talk about two other pillars of the Restorative Cities framework, which is the Playable and the Inclusive City. Oops. There we go. So in preparing the slides today, I was looking back and reflecting and thinking about my own formative years. I grew up in India, and during the school year, I spent my time in a really busy urban metropolitan area, which was almost 8 million people at that time. And during the summer, I looked forward to going into my grandma's place, which was a smaller town of about 500,000 people. And in reflecting in those two situations and going back and forth, Dr. Roe already posited we often think back to our childhoods and where did we feel restored, where did we enjoy playing outdoors, and thinking about those environments and the qualities of those environments and what they brought to us in feeling healthy and restored. And that also brought me to thinking about how that led me to doing what I do today. I have a bachelor's in architecture. I then went on to do a master's in urban design in St. Louis. And St. Louis was the perfect urban laboratory, I think, to study and test out all the theories that really inform my work today. And The Pruitt Igoe Myth was one of the first books and documentaries that I watched, and I was able to visit the site, and we studied about really the failure of housing at the neighborhood level, and why that was just not a combination of purely race and income, but also the built and the social environment, and how the building really contributed to its deterioration. And thinking about the people who lived there and my own childhood, I started reflecting on how our roaming range. So this is a map that's often referred to in the literature. This is a family of um, 4 people in one family across 4 generations. And this map has been replicated in cities across the world. It really talks about the home territories of children. So that big blob that you see in the center was the great-grandfather who was able to walk almost 6 miles in the 1920s. And over time, that boundary started shrinking. And the tiny yellow dot on the top left is from the 2000s, where the son was only allowed to walk just down the block, which is actually much higher than what most children get to even today. They're quite, constrained to their backyards if they have one. And we're living through a mental health crisis. The U.S. Surgeon General has put out several reports. Even last week, there was one talking about the mental health crisis on university campuses and students dropping out. And we're seeing learning challenges. We're seeing social withdrawal. We're seeing a range of mental health issues in our children. So when we talk about feeling restored and how to design restorative cities, I think the framework is interdisciplinary. We've already made note of that. And in the next couple of projects, I'm going to highlight how the playable and the inclusive interact with all the other pieces, like the green and the blue and the active. Following my PhD in public health, my first academic position was in Belfast in the United Kingdom. And one of the projects I worked on was urban renewal. Now, Northern Ireland, by and large, the pictures that you see are very lush and green. But as with every city, there are pockets of deprivation. And this one study that I led was the physical activity and regeneration of Connswater. It was a before and after experiment studying the impacts of a large urban greenway, almost 16 miles. And we looked at mapping and measuring the impact of the greenway across population subgroups. So one of our interest areas was looking at children and adolescents. And it involved a household survey, walkability assessments using GIS, public space mapping, systematic observations, and also some qualitative work. And one of the key findings that we're seeing in our results was that time spent in the greenway increased by about 25 minutes per day for children and youth. And of this time, 8 minutes were spent in instantaneous social interaction, and 5 minutes were spent helping to care for nature and the environment. And what this translated to on the ground was simple things like, children walking together as a group, walking school buses, picking up litter campaigns. We also did SOPARK, which is observing play and recreation in parks. And I'll point to this last finding that predominantly the users were male. And I'll circle back to that finding because that really raises a question of equity and who we are inviting to these new parks and green spaces and how can we make them more inclusive. So to give you an idea of programming and how we kept this project going, and it's still going, it's one of the most successful urban regeneration projects in the UK today. Programming was catered to children and youth, and we included children and youth through various participatory mapping exercises and designed programs around them. We have a youth legacy program where every quarter there are youth from the community that sign up to really take care of the Greenway and also train other children to participate. We also have programming across age groups. So there are family-oriented programs for older adults. So it's really an all-inclusive approach. So apart from design, how do we move on to then maintenance and implementation, and seeing the longevity of this project continue through? That's been really key to this. So moving to a different context altogether, which really highlights the equity piece, is an ongoing study in India called Active and Healthy Environments for Adolescents. And we're sampling 4 cities, adolescents in 4 cities, and particularly interested in 3 activity domains: the domestic, recreation and play, and transportation. And we're doing time use surveys, asking adolescents to respond to their behavior across the day. And this really highlights one of our key findings that we're seeing in some of our baseline qualitative research. There is a real interplay of social-cultural factors and gender norms. And this finding is persistent, whether you're talking about this in a low and middle income country or a developed country. There are clear patterns of behavior between young girls and young boys and how they use public spaces. Girls spend twice as much time indoors, and while boys spend a lot of that time outdoors. And in asking children there, what would help you be active, I think majority of the girls responded, and the underlying theme is make space for us. And how can we create spaces that are inclusive for different genders, for different age groups, varying race and class, and really mixing those and creating spaces that are all inclusive. So for young girls, what mattered more was smaller separate areas that they could then use themselves to, play hopscotch, or multi-use spaces, spaces for music and dance, and also swings. So I'll wrap up by highlighting the role of policy, because I see my research moving in that direction now. We have abundance of research. We know what's right, and we know what we should be doing, but why do we flounder, and where are these gaps? And I think the role of policy really needs to be highlighted here. Earlier this year, Congress passed a bipartisan act called the No Child Left Inside Act of 2022. And they really pointed out that children and young adults are disconnected from the natural environment, and COVID-19 has exacerbated that quite a lot. So as we're dealing with this, how do we design policy with all this great evidence that we have out there, and how do we convert this into real world change? So I'll have a play. Let's talk about this. What is the average time for research evidence to translate into practice? Does anyone want to take a guess how much time it takes? Never. Anyone else? That's my last slide, so I'm going to wrap up. A decade. Yeah. So the average time it takes is about 17 years for any intervention, or any kind of finding and research evidence to translate into written policy. And I think this puzzle that we see on the screen is really important, because we've seen examples of great work. We've seen examples of the Beacon site that Dr. Hibb spoke about, and how that approach to creating a school was really neighborhood focused. And what we need to remind ourselves is, when we think about children live in cities, but the unit of analysis is the neighborhood. We experience our lives at the street level. And it's really important that we pay attention to that plane of view, and really think through how we're going to connect all these dots, so that we can really start reducing that 17-year gap. So I'll wrap up with that, and I hope that will stimulate our conversation today.
Can you take a seat?
Sure. Do you want to leave the opening slide on?
I'll do that.
Okay,
sure. See it's back to the. Let's just. So we're going to spend about 10 minutes brainstorming between the 3 of us about the opportunities and challenges of moving this research agenda forward. And then we're going to open it up to all of you, because we're really keen to hear about your experiences, your thoughts on how we can build cities that address this tsunami of mental health problems that we're now facing. I'm going to move this mic, Dick. Is that correct?
Yep.
To there. Cool. So my first question to you both, thank you, by the way. Those were tremendous presentations, flagging exemplary work, but also some of the inequalities, some of the challenges. So I think in America, cities are moving slowly towards more active design, towards comfortable streets. I'm looking at Andrew Monshine, he's nodding his head. But, okay, why is mental health lagging so far behind design that is designed to improve physical health and physical activity? Thoughts?
So we discussed this a little at dinner last night, so I knew this was coming. And I'm certainly biased because I do a lot of physical activity research, but I think it's the ease of the evaluation, at least from the research side, because I started very much as an environmental psychologist and studying restoration. And it's a lot, at least at the time, was a lot of perceptions, a lot of surveys, and that type of research is super challenging, especially right now. But most of us have on a Garmin or an Apple Watch. And so being able to aggregate data from wearables or from phones is pretty easy. I mean, there's limitations. I've also used cameras for seeing how people use spaces. And so I just found it personally easier to evaluate using technology. Now, technology can be used. Cortisol and heart rate, skin conductance can be used in more mental or psychosocial health research. But I just don't think that the standard is quite there yet. And then the other piece that I brought up, I think last night, is also what we see. Like we see people running, we see people being physically active. We can see when somebody is not physically feeling well, whether they're limping, whether they're over or underweight. And we don't always and very often see folks who are experiencing challenges with their mental or psychosocial health. And so I think some of it is the availability of data. I think some of it is what we see every day. And I think that's part of why the bias is more towards physical health than psychosocial and mental health.
Thank you, Dr. Adlaka. Thoughts?
I think, yes, the invisible piece was on my mind too. We don't see it evidently, so it's harder to translate that research then into policy change because there's not much evidence out there. So there's a gap between data and measurement and then the policy connection too. So it really involves closing that loop, I think. And especially with your book, it really, I think there's a space there where we can speak to real policymakers and bring that framework to them and present them with some best practices and case studies and introduce them to how it's being done.
Those are great thoughts. My own thought is about communication and how we communicate the benefits, particularly to a lay public. And that is one thing that the book is trying to do, is to simplify very complex research from psychiatry, from medicine, from psychology into simple graphics. I don't think we're good at communicating research personally. And I think we're not good at communicating it to a public who can then demand for change. And I think one thing that COVID has done is it has brought the public out onto our streets. It has increased the demand for public space, for high quality public space. And I do believe it's the public who are really going to advocate for that now and lever change. And policy and research needs to keep up. So thank you for those thoughts. We'll bring in your comments in a moment. I want to talk about the cultural gaps in restorative environment research. So just about all of the work cited in the book, talked about today, is coming from high-income countries, okay? You're doing extraordinary work in low to middle-income countries. And we were talking about this also earlier, the use of the terminology green infrastructure, blue infrastructure. How helpful is this? Because in parts of India and Africa, there's brown infrastructure, there's desert infrastructure. So can I pass it over to you first, Dr. Adalaka, to respond to that?
So I think it depends on scale. When we're talking about really hyper-urban, very dense metropolitan contexts, there are ways to build in restoration, whether that is through micro-restoration, it could be pocket parks, it could be even balconies. There was a study out a few months ago about just the sight of plants from your window and how that leads to bursts of restoration. So building those opportunities within housing, I think housing is a key pillar that we often tend to ignore. Good housing, it doesn't have to be skyscrapers. There are ways to build density for livability and for restoration. And I think in those contexts, it's really important to pay attention to the architectural style of buildings and the way they're designed.
Thank you.
Yeah, I mean, I don't know that this is where you thought this might go, but I'm like, as a parent and as a spouse, my wife is Asian American and my 3 children are Black. They're African American. And so this is very much a lived experience, not a research experience. But as somebody who grew up in the mountains of North Carolina, and I find my restoration in going to parks or hiking or camping, I do not feel comfortable taking my children in these spaces because they're not represented, and racism is very much still alive. And these spaces aren't inviting for Black and brown people. And I can tell you, as a parent also of Black children, especially young Black boys, that the increase in stress and worry that I feel, and then the need then for further restoration. And I'm able to do that as, a cisgendered white man, but my friends and my colleagues and my children's biological family, they've got that stress as Black and brown families, and they then are not able to relieve the stress in the same areas that at least I find beneficial. And so I think it's super challenging. I think there's just environments and communities and spaces aren't built right now, and society, U.S. focused for sure, but I think it's a global concern as well, that there are a lot of challenges.
So I'm glad you brought up the equity piece, because it's so important. And I think my final question to you both is, how do we really leverage the research into policy to bring about change, the kind of change that you're speaking about that needs to happen to make access to these hotspots for mental health more equitable? Big question.
It is a big question. I'm going to stare at Deepti so she answers first.
I'm thinking about what I do in India and in some other countries, what I've experienced. There is a real lack of space there. Mm-hmm. And it's not easy to just build a new park or introduce any kind of green space. But what we can do is preserve what we have and make sure that what we have is easily accessible. And accessible to people of all incomes and all age groups and different genders. And I think the point I made about designing streets, I think streets are our most underutilized and understudied spaces, public spaces, the public realm. What if our streets were designed to be green streets all over? What if there was a network of green streets and they would serve to be restorative spaces as well? And so whether you live in a low-income neighborhood or suburbia, you would have that infrastructure there.
I'm just going to interject at this
Please.
point. The great thing about streets and pocket microspaces is they can connect and they can build longer trails depending upon your physical activity levels. You can go for a 10-mile walk through a green trail or just potter around your neighborhood. So connection of these spaces is super important. Aaron?
Yeah, I mean, I do think top-down policy is important, and I think obviously federal acts like the No Child Left Inside is important. I see a lot of benefit kind of in that second project, the purpose-built communities, that these community-driven projects that are community-driven, community-designed for implementation and dissemination, community-designed for evaluation, but also with the community. So the community has access to their own data So they have access to the data to take to the council, to take to state representative. And so that the communities are advocating for the change and the policy to happen. You obviously need both, right? But I will put a plug in for the communities working with their own data and working together to advocate for the changes that they need, and then the policy coming out of those communications.
Fabulous. So I'm going to pass it over to you because there is some real expertise in this room around these issues, and we welcome questions from all of you. Thoughts, responses to what you've heard, questions for our panelists. Andrew Monshine, thank you.
That was fantastic. It was so great to hear about your research, and Jenny, thank you for bringing everyone together today. So there's a million things that I could ask that hopefully, I'll get a chance to do it in a different setting. But, I am a transportation planner. That's where my training is. You mentioned UCI, social ecology, I became interested in environmental psychology kind of up at UCLA, but looking down at UCI, going, that's really cool. But I think that, as a transportation planner, I'm curious. I'm convinced, and the work I do really touches on a lot of this, but in your conversations with transportation planners, wherever you are, whether it's, in North Carolina or whether it's in India or wherever it is, what is the response you get? Because transportation planners and frankly engineers, we barely get past the idea that transportation is more than just throughput, and so getting to the level of something you can't measure or is very hard to measure, as you said, is difficult. So I'm curious, just for us in this room, in this professional school, how do you see that, and what kind of responses do you get? And for both. So.
Yeah, that's a tough one. Data talks. I know that's part of your question, right? That there's not always the data to support, because every conversation I've had with transportation planners has been data forward. Here is the data. But some of that's on, streets with street trees, the greening of streets and the data there. And so I think, and I'm sure you're the same way, and all of you are the same way, and I know both of you are, you have to sometimes sneak in some of the mental and psychosocial health to the project. We're going to focus on street trees, shade, spending money in the store, and getting people to move. But here is what maybe individually we're interested in the community. And so sometimes you have to be a little subversive with getting this into projects.
Well, that makes sense, and I want to hear what you think. But I think it's true. It's really problematic, and I think coming up with metrics that can be universally applied maybe isn't the right thing, but it is also what engineers and planners want to see if they're going to invest money in infrastructure. Yeah.
So I'll look at examples of tactical urbanism that popped up during the pandemic. And I saw this happening live play out in India, where the city council wasn't doing anything. So residents themselves just, got together and blocked off their streets and gave their kids a place to play. And that then turned into a citywide movement, and it's now called Happy Streets. And that brought the council on board. So I think it's a combination of top-down, bottom-up, you get the community to mobilize and do these things together. And I think COVID was sad that we had to wait for a pandemic to do that. But it has brought about change in many communities.
Just on that point, I just would say about leadership, if you look at what's happening in the city of Paris under the mayor there, she was elected on a mandate to maintain the changes that had occurred to the streets of Paris during the pandemic. Very powerful example of how the role politics has to play in all of this. So it is a political process as much as it is a policy and design process. Other questions? I'm going to go to Paula first.
Yeah, I just wanted to point out, where would you put safety and feeling safe in these green communities? I'm looking at the pillars, and I guess it could go just about maybe neighborly feeling safe and getting outside. I know growing up, I could go anywhere in the city, and I wouldn't encourage my children to go out anywhere in the city. And the areas that have been developed for community have drawn a large homeless population, which, you know, it sort of intimidates people to travel into those green areas.
I mean, I think safety could probably fit anywhere, which I assume you would agree with. Just a quick example from this morning, I went for a run, around campus and the streets here. And my home in North Carolina is next to a park, and so I run in the park all the time. And so this was more urban running for me. And I did not feel safe at all. One, like there were so many cracks on the sidewalks. There weren't curb cuts. The sidewalks were tiny. They were thin. But because they were thin, and if a student was walking towards class and I'm running away, I have to pop out on the street, or somebody has to, right? And so I run for physical activity, but also for my mental health. And I was so much in this hard fascination, like I was focused on not tripping, not running into people, not hitting the light pole, not getting run over, that I was getting my physical activity, but the mental relief that I usually get from running did not happen this morning. And so that's just, a bias. But I think you've got to feel safe and comfortable, and you've got to feel like that you belong and you're representative to have any type of restoration, I believe.
I think safety, from my experience, it's really connected to aesthetics in some of the contexts that I've worked on. And the green piece really stands out there. Having street trees, having greenery around, and that offers, other benefits like shade and feeling comfortable while being outdoors.
I thought the map, Melanie, I'll come to you in a minute.
I've been thinking about safety too. I grew up in rural Minnesota, so I got my real renewal from being out in nature by myself. And now, as I get older, well, even then, it's like you talking about going to the mountains and not wanting to bring your children, or the Greenway in Northern Ireland. How do you keep a 16-mile Greenway space that is so wonderful, safe for everybody? Not in terms of tripping, but in terms of other people.
Eyes on the street. I'll go back to Jane Jacobs' theory of eyes on the street. So that Greenway was designed with attention to the surroundings and the boundaries and mixed land use, and ensuring that there is enough activity happening along sections of the Greenway so it's not deserted all the time. And at night too, there are people either walking their dog at night. And so I think it's a combination of those factors. And yes, there is a role of surveillance and having security around when needed. So there are security poles that you can, reach a security person if something happens. But I think by design, having those eyes on the street has really helped bring life into that area.
So we have time for one more question. Don't go, because there is lunch for you. A light lunch. You had a question.
Yeah, I was hoping you might be able to talk a little bit more about how you balance your professional expertise and the input of the community when working on those sorts of projects, and how you balance letting a community lead a project that they may not have expertise in.
Good question. Thank you.
Yeah, that's a great question. You kind of have to. It's challenging, right? And so it helps to do this as you're able to. I think it's especially challenging for graduate students and early career professionals. As a tenured faculty member, having academic papers still important, but not as important. And so it's really only been in the past 3 or 4 years that I have felt more comfortable in taking this on and knowing that what might come out of this is a single letter to the editor. It's a bit of a cop-out. Some of it's career stage that I can take those risks now. But I do try and communicate pieces. So maybe it's more not the outcome, but it's the process that you're trying to communicate. and looking for opportunities to professionally communicate like what's happening there. So maybe it's not some great change at the end, but this is the process of engaging with the community that seemed to work or not. Like maybe we used technology, maybe we didn't use technology. But in the end, if it's not community-centered, if it's not what the community needs, regardless if I think they need a Greenway and a meditation garden and a bus rapid transit, if the community doesn't see those things, then anything I'm pushing for isn't going to be successful because the community isn't desiring it.
Yeah, I think of myself as a facilitator, and you switch between roles, whether you're in design, you're a designer sometimes you're just introducing, making the connections on the ground, and then letting the community take the lead on it. So I think it switches around depending on the context.
Being at a public university helps, right? I mean, it helps. I know Virginia Tech is the land-grant institution in Virginia, but being at a land-grant institution, having that infrastructure of extension and 4-H and that really helps. And obviously, I mean, UVA is public, but you also have access to extension through being a public institution. So there are opportunities, I think, at public universities that do facilitate that better.
Well, thank you. We're going to close it there. For those of you who are interested in Restorative Cities as an option to study with me next spring in a Healthy Cities class, it's really very interdisciplinary. It brings in students from all around the university. That's just a plug for that. It's finally to thank you for coming. There is a very light lunch in the Nog. Am I pronouncing that properly? Students here, Ashley, will show us where the Nog is, for those of you who don't know where it is. And finally, to thank our two guest speakers who've traveled some distance to be with us today. So thank you.